Hello, everybody. I'm Eran Agmon, and I'm going to talk a little bit about Sensifree and what we're doing to innovate blood pressure monitoring in hospitals. Starting with 30-day post-operative mortality, it is well documented that about 2% of adult surgical patients undergoing non-cardiac surgery die within 30 days of the operation. And the number one reason for these complications and mortality is cardiovascular complications. Some recent studies demonstrated strong association between episodes of low blood pressure during the surgery and the development of cardiovascular complications shortly after that. And here's the problem. In the vast majority of the cases, blood pressure is monitored using a cuff, and the cuff provides only intermittent measurement and therefore misses important trends and events during the surgery. Now, there is an option to monitor blood pressure using the invasive arterial line, but it comes with its own set of complexities. And therefore, there is a monitoring gap between what the cuff is able to do and the burdensome arterial line. And so anesthesiologists would love to use something that does better than the cuff without the complexity of the arterial line. So we went out and developed it. Sensifree 100 is the world's first product of its kind. It uses the very simple to use fingertip optical sensor. It was developed with anesthesiologists for anesthesiologists, and therefore it's fully compatible with current medical practices. It's clinically proven. We have demonstrated the accuracy of the device in studies against a reference arterial line measurement. And while this is not a new unmet clinical need, there is very little competition out there because this is a hard problem to solve. And so the two products that are out there in the market today are fairly complex to use and are very, very expensive. This is what limits their market penetration for now. We're building a strong intellectual property portfolio. We just received our first patent in the US. We have several more in the pipeline, and we go multinational filing. This is what we're doing for critical care. We have a pipeline of products for additional indications and other use cases. We estimated the global market for Sensifree is several billions of dollars. About 1/3 of it is in critical care, and there are additional opportunities in the hospital. Our business model is straightforward. We either lease or sell the equipment. We expect to sell it for $3,000. And this number reflects a healthy gross margin of more than 80% to the company. We have already got our CE certification. We're in the similar process with the FDA. Our team, one of our greatest assets, together with me leading the company, is Ilan Barak, our CTO. And we are honored to work with Professor Art Wallace from UCSF and Dan Sessler from the Cleveland Clinic. We already started strategic discussions with all the names you see here in front of you. Each one of them is a potential acquirer of the company. And we're currently raising a $1.5 million safe round to complete our FDA clearance and start generating revenues next year. The terms of the safe round are 20% discount and $30 million valuation cap. This is Sensifree, and this is what we're doing in innovating blood pressure in hospitals. Thank you.